The Ministry of Health has intensified efforts to combat Kala-azar in Wajir County, where the death toll has risen to 25, with over 600 infections, mostly among children. Public Health Peers Mary Mudhoni has flagged off mobile labs to the region, aiming to enhance early diagnoses and improve treatment. She confirmed that the National Treasury has released funds to aid in the response, alongside support from development partners providing drugs and medical supplies. With 106 patients currently receiving treatment at Wajir Level 4 Hospital, county officials have admitted to overwhelmed facilities, citing water shortages and limited test kits.
Ministry of Health, again, is working with the county government of Wajir, especially because of the numbers that have been welling up every other day, to respond to the outbreak and provide technical support. We already have numbers of medical personnel who are in Wajir County and Marsabit County to support the teams that are on the ground. Commodities for laboratory, diagnosis and medicine are also being provided. We have come together with development partners who have been able to assist us with drugs and other commodities.
Health Cabinet Secretary Aden Duale now says that 60% of private clinics in residential areas will be shut down once the Social Health Authority is fully implemented. Speaking in Nairobi, Duale claimed that many of these clinics were fraudulently established under the now defunct National Health Insurance Fund. He accused those opposing Shah of being part of a health sector cartels benefiting from the system. Duale assured that the government is committed to streamlining the sector to ensure equitable healthcare for all Kenyans.
Thirdly, those who are making noise about Shah, every night I watch news. The common currency is 30 billion NHIF bill. I am telling you, mark my word today, the day Shah takes root, 60% of the many clinics you see in estates, they will close. Most hospitals that you thought were doing good work were open because of the fraud that was taking place in NHIF. So you can find Kenyans today. I found a member of parliament this morning, and he told me, my mother is being treated for dialysis in one of the hospitals for free for the first time. So don't listen to the propaganda. The people who are fighting are the cartels.
With just days before President William Ruto's official visit to Mount Kenya, his allies are intensifying efforts to ensure it's a success. Deputy President Kithure Kindiki led a high-level delegation to Tharaka Nithi, Murang'a and Kiambu, inspecting development projects, including road construction, water supply systems and educational institutions. The government aims to showcase its progress and development pledges in the region. Kindiki emphasized that the visit will highlight key achievements and launch new initiatives to boost economic growth.
Next week Mungu akitujalia, rais wa Kenya anakuja hapa Murang'a. Si namna hii, na haja kuja mkutano ya siasa, amekuja kufungua masoko yetu. Mungetaka rais atembea hapa Murang'a, afike huko Mathioya na Maragwa, akuje asikuje.
Local leaders and residents are eagerly anticipating the visit, hoping for renewed commitments to address pressing issues such as agriculture, trade and job creation.
Pearl Newsbeat.
The Senate has approved an additional 50.5 billion Kenya shillings for counties, including 532 million shillings for the completion of county headquarters in Nyandarua, Tana River, Tharaka Nithi, Isiolo and Lamu. The funds come after the government scrapped a 444 million allocation for county constructions in the 2024-25 budget. Senators also allocated 3.2 billion shillings for community health promoters under the Universal Healthcare Plan amid delays in stipend payments. Additionally, 1.759 billion Kenya shillings will cover county health workers' salary arrears, while 19 counties will receive 2 billion shillings for county aggregation and industrial packs.
Pearl Newsbeat.
The Supreme Council of Kenya Muslims has confirmed that the family of Stephen Munyako has received 129 million Kenya shillings in blood money, securing his pardon from execution in Saudi Arabia. Subkem Che Hassan Nado assured that the funds provided by the Muslim World League have been delivered and the release process has begun. This comes after initial confusion, with the family stating they have not received any funds, despite an announcement by UDA Secretary General Hassan Omar, with a confirmation Munyako is expected to return home soon.
Thank the government of the Kingdom of Saudi Arabia, because from time to time they were extending an opportunity, the term of execution, because the court will give the date of execution. But the government has been pushing from behind the scenes the delay, giving the family and Kenya an opportunity to work around the clock to see how they can save the life of Steve. We are grateful for that extension. Otherwise, we could have not been where we are today. The mother is online. The mother of Steve is online. I just explained that she was not able to join us because of the weather today, but she is graciously online with us here.
Meanwhile, the government continues efforts to help a migrant in Dota who faces a death penalty in Vietnam.
Pearl Newsbeat.
And across borders, the United Nations has sounded the alarm of a deepening humanitarian crisis in the Democratic Republic of Congo, where 28 million people are facing acute hunger, the highest number ever recorded in the country. The crisis is primarily driven by escalating violence between government forces and Rwandan-backed M23 rebels in the eastern region, which has displaced hundreds of thousands and led to a sharp increase in food prices. The ongoing conflict has exacerbated an already dire situation, making food access nearly impossible for millions. According to the UN, nearly 4 million people are now in phase 4 hunger, a classification that indicates an emergency level of food insecurity. Over 10 million people in eastern Congo are among the hardest hit, struggling with insecurity, displacement, and a soaring food cost. The economic crisis in DRC has further worsened the situation, with inflation and the devaluation of the Congolese franc making basic food items unaffordable for many. The UN is now calling for immediate humanitarian intervention to prevent a catastrophe, urging the international community to act swiftly as millions face the risk of starvation and malnutrition.
Pearl Radio, the home of fresh and classic hits.